Hi, this is your Sussex County chiropractor, Dr. Will Holdsworth from Pain Relief Chiropractic. I'm going to show you a video today with Sue here to show you how to tape your elbow if you have pain. So it's pretty simple. What you're going to do is you're basically going to ask the person, or if you have the elbow pain yourself, where is the pain that you're feeling?
Oh, goes right both sides.
So she has it like kind of in the joint line, both sides on either side this way. So what you're going to do is you're going to make sure that you get some tape to cover those areas. It's pretty simple. I'm going to take the tape, go like this, and cover the area that we're going to do. So if you could see that there. I'm going to line that up and just remember where I need to cut. Most of this Kinesiology tape has something on the back to show you kind of like landmarks to where you want to cut. This has a grid, which is nice. I'm going to cut another size that's the same length as the first one, because we're going to have to do both sides because she has elbow pain on both sides. You can relax your arm so you don't have to get discomfort while we're doing this. The next step you do with tapes like this is like a strip of tape. Some of them are already cut, and they're cut in such a way they're like pre-cut, so you just kind of tear them and they're already rounded edges, which is nice because you need rounded edges so that the tape stays on longer. If you have an edge like this that's more of like a corner, it's going to be easier for you to catch your sleeve or another piece of clothing or something else on that corner, and that's going to cause the tape to get caught and then potentially come up in that area. So I'm cutting and rounding the corners out here, trying not to get any edges, just more of like a smooth surface instead. Easy way to speed that process up is you just fold the tape over on itself so that you're cutting both ends of the tape at once. And we're going around. And so now we have the two pieces that we're going to keep here. So the way that we're going to do this is we're going to actually have her bend her elbow as much as she can, and we're, again, trying to make contact here. When you rip the tape, an easy way to do it without getting your fingers on it so that the grease or whatever oil on your hands touches the stickiness, the adhesive, and now you're getting less sticky tape. You instead rip it the way I just did, and you peel back. That way you're only touching the paper that the tape is attached to. By having her bend her elbow, we're going to get her natural anatomy to take into account of the tension of the tape. I add a little bit of tension anyway before I stick it down there, and we just follow, and then we're going to go around her elbow here, and we'll keep her in that position for a second, and then we're going to basically come around this way so we can get the other side. So it's like right in here. I don't know if you can see that, but right around in here. We're going to rip the tape. Once again, this is how I'm ripping it. Pulling it apart. Taking the plastic, pulling back. Bending it so I can touch just the paper and not the adhesive. And you want to avoid the crease here. But the cool thing about this taping concept that I'm showing you is it's pretty much the same for any area of the body that you're working on. So once again, she's going to straighten her elbow out. We're going to show you again, she's got pain on either side right in here. So what I want to do is make another contact point for the tape. The overlapping area of the tape is going to cause the area to be relieved of discomfort. So if you're not overlapping two different pieces of tape, you're not getting the effect that you're looking for. So you want to make sure that there's at least two pieces of tape that you're using, and let's just say the X, or where the tape overlaps, that's the site of pain that you want to focus on. So we're going to bend the elbow again, and I'm going to just go around this way because this is where it's hurting, right?
Yep. So
we're going to take the tape, doing our pull, the way that we do it, nice and easy, and yeah, that's perfect. Making sure that it's fully stuck, and then when you're done, or if you're doing it on someone else, have them straighten out. And what you want to see is this. Sorry. We'll go like that. if you go like this and you look at it, you see how the tape is pulling the skin upward, kind of away from her body? That's what you want. When you have the tape on like that, it pulls the skin upward because you have a layer of skin, layer of fascia, and then a layer of muscle. If you're pulling the skin up off of the fascia, then the 3 different tissues, they slide better together, which is why you get that pain relief feeling, and you feel an improvement in the functionality of the area as well. How's that feel?
Feels good.
Feels good.
Yep.
All right, well, thanks for watching this video. Thanks for doing the demo there with me, Sue. We got a little tape left over, which is cool. And, you know, as far as like tape goes, I personally like rock tape the best. I think it sticks the best. You can keep the tape on for 5 days, up to 5 days. Shower with it. You know, I wouldn't like submerge it and go swimming or whatever. You can, but it's probably going to come off. Don't try to force it off, though. Let it come off in time because it's going to remove some hair and it's going to not feel very comfortable. Thanks again for watching this video. I'm your Sussex County chiropractor, Dr. Will Holdsworth from Pain Relief Chiropractic.